was a baby, you would come up and pinch my nose.
It's a common practice among Filipinos that, you try to pinch your nose with the thought that it might make your bridge taller.
Thanks, Mom. My name is Melissa, and I lost half of my nose from a simple filler injection. My nose is scarred and chunky, and it kind of goes off to the side. My nose died, and I am trying to bring it back to life. I grew up in a Filipino family, and in our culture, there's a really large emphasis on beauty. I had a much flatter nose bridge than anyone else in my family, and that eventually started to really affect me. Fast forward to 2017, I came across non-surgical rhinoplasty, and I thought that I could finally have my nose fixed. And I went ahead and I made an appointment. The reason that I wanted to go ahead with the non-surgical rhinoplasty was because it was supposed to be a temporary thing, and the filler would eventually dissolve. Ultimately, I just wanted to see what I would look like with a taller nose. I felt the injections. They hurt just a little bit, but not terribly. After the injections were over, I took a look in the mirror and I thought, dang, I look good. The following night, I noticed that there were white little pustules forming. It was really scary. I decided to drive to the ER. The doctor told me that there was an occlusion, that some of the filler had blocked blood flow. And right away, the doctor started the treatment, which involved 20 to 30 injections of hyaluronidase for 5 days, and it felt like hell. I slowly watched my nose die. It went from looking like a nose to almost like cooked cauliflower.
I thought your whole nose was gonna be gone because it was pretty much all black.
Right. Day by day, I would notice that this nostril started to shrink. I lived with that for a year. We went ahead and we scheduled a reconstructive rhinoplasty. After that surgery, my nose just looked really bulky and thick. Every morning when I wake up, a little part of me feels like a monster.
You know you're beautiful. I tell you you're beautiful almost every day.
It'd be awesome if my nose could be straighter, and if I could get a bridge as well, that'd be a plus. I have not let go of my bridge dreams.
Love you too. Look at this.
You gained a little bit of fat.
Oh, a little bit. 2 weeks in France. In 2 weeks, I gained 16 pounds.
I'm not gonna make fun of you because that's how I am. I'm that kind of a guy. You, if that was me and I told you what happened to me, you probably would put it on your Instagram again and make some funny comments about me being fat again.
Why does this turn into like that? You know what? You ever heard the expression? Wait, have you ever heard the expression "humble brag"?
Yes.
That was called a humble rag.
I'm sorry, my baby, that if you feel bad.
I may have gained a few pounds on this vacation, but trust me, I still look way better than Paul in a mankini.
So here we go. Take a look. Boom! Look at that. Look at the necrosis.
Ooh!
I mean, can you imagine being that doctor that did this?
I would flip out. Do you know what that looks like to me? Death.
So we need to help her now.
All right.
Can you please send in Melissa?
Hello.
Melissa, hi.
Hi, nice to meet you.
Dr. Nassif, nice to meet you.
I'm Terry Dubrow.
Hi, Dr. Dubrow.
Over the last few years, I've seen Melissa go through significant changes in her personality. She used to be so outgoing. Now she's always thinking about the negative. What's the worst that could go wrong? And that she has that in her head that it's gonna happen.
So can you start from the beginning?
Okay, well, it started from when I was little growing up. I always wanted the taller nose bridge. And then I got married in 2016, and then in 2017, we had our son. 2 weeks later, Matt was deployed.
Mm-hmm. Oh, you're in the military?
Oh, yeah, yes.
Yes.
What branch of the
Navy.
military?
What do you do?
Explosive ordnance disposal.
You mean IEDs?
Yep, yeah, stuff like that, or rockets, bombs, whatever.
That's cool. So you have a baby, you get deployed, what happens?
Like I said, my nose has kind of been an ongoing issue. So I found a doctor that could do the injections. I wanted to see if maybe, he could build up the bridge.
When you inject a little bit of filler, doesn't matter what kind of filler it is, it could occlude or block the blood vessel. That can kill off the entire nasal skin. And that is exactly what happened to Melissa.
24 hours later, it started to get a little bit painful. So that is when I decided to go to the ER. And then the ER doctor said that, yes, it is in fact occlusion. And then explained to me, all right, we're gonna start some injections to try and dissolve the filler. And then slowly but surely, of course, the tissue came off little by little. Once all of the scabbing came off, I had my reconstruction. They took tissue from here,
Put it up to
folded
your
it
nostril.
over, yeah.
It's a nasolabial flap. Until you get new blood supply, you have it attached.
Right, so it was, I don't know, it just looked odd.
So during this, did you tell him about this?
Yeah, especially with that fun job of yours.
Right.
Yeah, so I didn't tell him that I was going to get it done.
So you came home to your wife after doing this dangerous duty to a
deformed
shrunken,
nose.
Right.
deformed nose. Whoa, tough situation.
She second guesses herself a lot. She feels like she needs to ask me everything before she does something. Oh, do you think this is a good idea? Before I left, this wouldn't have been an issue.
I don't even notice that. Do I ask you all the time?
Yeah.
You're insecure, you've lost self-confidence, and you're self-conscious about it. That's what it is.
I don't even notice.
Yeah.
I'm
okay.
sorry.
It's okay.
I'm sorry for going behind your back. I'm sorry for the weight that I might feel like I add, that I add on you. It makes me cry because I make it harder for him. I try to do my best that I can, but I know that he gets a lot of the crappy end of the stick just because of sometimes how down I feel about myself.
Okay, so now here comes the most important point for you with us is, what are you trying to do?
I would really like if you could just make it look even more symmetrical. And I mean, heck, if you could throw on a bridge, that'd be wonderful.
That's a nice challenge.
You're not gonna get 100%.
Tell me about this whole area here.
This drives me very crazy.
What drives you crazy with what you're pointing at?
It's just like a flat thing, especially compared to this
So there's
nostril.
no crease, nothing on
Right,
that
there's no
side.
crease.
So in summary, what you want to try to do is match the left side of your nose.
Yes.
Okay. The good news is, I think we can help you.
Nice.
All right? Here, we do need a little piece of rib cartilage. To get you some height, as long as we can do it. To get your nose straight, we're gonna put some cartilage on your right side to help push the nose over a little bit more to the left. Have I done those before? Yes. The improvement has been anywhere between 20% and 60%.
Okay.
But I'm not gonna be able to match this side perfectly at all. And I could even make it worse. That's a risk. When I take a piece of skin and cartilage and transplant it there, there's a chance that that can die and become necrotic.
Right. The risks do scare me just because I know what necrosis looks like. I wore it on my face, but I know that there are brighter sides to things, and I'm hopeful that this will be one of them. I'm just ready to do it.
Seems like you're in agreement.
I am in agreement. Let's get it done.
What do you say when you put on all the stuff? It's time to what? Suit up?
That's it.
Yeah, it's time to suit up, baby.
Morning.
Good morning.
My name is Melissa. I'm here to check in for my surgery today.
All right, please have a seat and we'll be right with you.
Thank you. I am feeling like I'm gonna throw up. What if I wake up to another dying nose?
Dr. Nassif is ready to see you now.
Oh,
Come on in.
okay. Love you. I'll see you later, okay?
Really do hope that Melissa gets back to the confident woman that she used to be without needing to be reassured about a lot of the things that she does. If the doctors fix her, I really do think this would help our relationship a ton.
We'll take good care of you.
Thank you.
Okay.
Thank you.
For Melissa's surgery today, I'm going to harvest a composite graft from Melissa's left ear while my team harvests rib. I will then open the nose and use the cartilage to build up the dorsum, spread her grafts to open up her airway, tip grafts to give her projection, and a small composite graft to lower the right nostril. Finally, I will make an incision along the outside of Melissa's nose and use pieces of the composite graft to make the cheek flap on the right have a more normal-looking contour.
How are you?
Young lady.
Good. Better today.
So we increased the tip projection. We did a glue canoe.
Right?
Put that along the dorsum, put a composite graft in the right nostril,
So you made an incision out here.
made an incision,
Oh, okay.
and then put in the large composite graft along the whole right side of the nose to create kind of a normal contour to match the left side.
He went for
Right?
the whole thing.
Whole thing.
Wow.
Now let me take a look at your nose. Let me just keep the light on for a minute. Okay, so it's a little bit grayish color. Yeah, there's a little bit of venous congestion in there. Melissa has some venous congestion. In other words, her nose is turning a little bit purple. So our goal is to squeeze out the blood to help the blood go in and go out easier. If blood doesn't go in, the graft is gonna die. So the best thing to do is just squeeze it out so that Melissa can heal a lot faster. So let's now just see how you heal, and then when the cast comes off, then we'll get a good look at it together.
Okay.
How are you?
Melissa,
I'm good.
how are you?
Good to see you
Yeah?
again.
How you doing? It's been a couple months since Melissa's surgery. Last time I saw her, the side of her nose really didn't look that great because Melissa's surgery was really difficult, but also these grafts are difficult to heal. That takes months. So today we're gonna do a follow-up and see how she's improving. All right, so I have to tell you, this is getting better and better. It's a work in progress, obviously. When I look at this, I see now more of a delineation between that cheek, especially compared to the last few months, and the side of the nose.
Right after surgery, it looked like a hot mess. Not hot mess, but it was, you know, it was swollen. But Dr. Nassif has put me through a couple of rounds of injections to help with the swelling. I've had laser treatments done to help with the redness and the texture.
How do you like this, this glue canoe, we called it?
I love it.
You know, it looks good, huh?
Week by week, it's getting smoother. The swelling is going down. I know it's still a little bit uneven on this side, but I completely understand that it's gonna take a lot of time.
I'm gonna say in another 7 more months, that will be a year. Compared to now, you're even gonna be a lot happier. But again, this is a long-term healing process. And a year.
Okay.
I wanna check on you.
Okay.
Yeah.
Okay.
I'm super grateful to Dr. Nassif and Dr. Dubrow. Since Melissa's surgery with Dr. Nassif, her confidence has greatly improved. She doesn't question herself. She's just getting out there and doing her thing. It's great to see.
Thank you, guys.
Thank you. Bye-bye.
It's almost like they gave us a second chance. And I don't really know where it's gonna bring us, but it seems like it's gonna be a good place. Look at the puppy.
Oh my gosh, so cute.
That dog is so happy.
I would be too. Running around all willy-nilly like.
I know.
Before my surgery, my nose was destroyed by necrosis, and I felt like a monster, and I would constantly second-guess any decision I had to make, which had a negative effect on the relationship with my husband. Now, thanks to Dr. Nassif, my nose is close to being back to normal, and I now have the bridge that I've always wanted. I know my nose isn't perfect, but I'm hoping that over time, it will only continue to look better and better.
It's hard to put into words how strong you've been through all this. Because starting off, when it all happened, I mean, I wasn't there. You had to deal with this all by yourself. Just now, here you are, like a brand new woman almost.
You know, even a year ago, if you were to tell me that I'd be feeling this way about myself, the way that I feel now, I wouldn't have believed you. To most people, it might not look completely normal yet, but for me, it's changed my life. Brought me back to life, really.
I'm just glad I could be a part of it this time.
Me too.